My name is Gilbert Kokwaro. I'm Director of Institute of Healthcare Management at Strathmore University. I'm Professor of Health Systems Research, if that does not sound too pompous. But essentially, I'm looking after the health-related courses in Strathmore. Well, human resource for health is a critical component in the delivery of basic health care. And really, that's the point where we have been having problems. Without our own human resource or people to actually deliver the services, whatever investment we are putting in health will not achieve the goal. Let me give an example in a very simple way to understand. Kenya has got 2 doctors serving approximately 10,000 Kenyans. That just gives me an idea of how critical the shortage is. Kenya cannot afford to be training doctors for other countries. It's very, very expensive. But that's what we have been doing. More than half of the doctors trained in Kenya hardly stay here beyond 5 years. And that's really not the way to invest in human resource for health. I think the first thing we need to do is a complete change in mindset. Let me tell you what I mean. Investing in human resource for health should not be looked at from simple expenditure point of view. No. This is an investment, and it should be a sustainable investment that gives us some goals and some returns on investment if we want to. So what should we do? We really need strategies to not only retain what we have, but to start increasing the numbers. 2 doctors per 10,000 is not really something that you can be proud of. We need to do massive investment to increase that number. So what do you need to do? The first thing is to appreciate that this is a cadre that Kenyans really need for critical services. How do you do that? I have problems with the current job classification. It is ill thought of, it is outdated, it is something that actually we should not even be proud of talking about. What we should be doing is not to classify workers according to job groups and lump everybody there. That will not work. It will not work. In fact, the country is going to fail if there's the thinking of those who should be doing that. What should be done is to classify workers into clusters, professional clusters. And within those clusters, you produce a scheme that balances the resources available with people's qualifications. Unfortunately, meritocracy is not very much valued in Kenya. To get a doctor trained through the medical school takes time and investment. We need to find ways of making sure that 1, the work environment has got the necessary resources for these people to work with. 2, we have said that we don't have enough doctors. So this argument about not having enough money to pay the doctors we have is utter rubbish, because it doesn't tally. If we don't have enough, why can't we pay those that we have enough money so that they remain in Kenya? The problem in Kenya is not lack of money. The problem in Kenya is not lack of money. The main problem in Kenya is actually efficient use of the resources we have. In fact, devolution has made the distribution and the density of health workers even worse, because some people don't want to go in some countries. In fact, some people are encountering some barriers, artificial barriers that are county specific. For example, I don't know whether this is true, but there are some counties that insist on only having workers that come from that particular area. Yet we know very well that there's a disparity in the number of health workers. Not only are they few, but you can't really insist that you only want workers from there, because then it is not going to work. What should be done again is, after creating the clusters I've talked about, is to create a central body that then employs and looked after the welfare of all health workers, a central body delinked from the petty politics at the central government and the counties. And that body should be able to negotiate attractive packages for all cadres workers. I don't think most Kenyans, let alone doctors, most Kenyans want to work outside the country. Most Kenyans are very patriotic. We have a very beautiful country. If you can earn the basic salary that allows you to, maintain a decent life, nobody wants to go across the border. If we can look after the few doctors and nurses, pharmacists and dentists that we have here, then we can start talking of sustainable building of our health system. Otherwise, from the figures I mentioned to you earlier, the situation is likely to get worse before it gets better.